My name is Diana Starrs. I'm the Injury Prevention Coordinator here at Robert Wood Johnson. And I would like to, sorry, I didn't know if he was there. I would like to introduce you to Michael Belendo, who is going to provide our welcome and just share some remarks with you, and then we'll get started with the official program.
I'm Michael Belendo. I'm an Assistant Vice President for Nursing and Patient Services here at the hospital, and it's my pleasure to welcome you all this evening. I hope everybody get a chance to eat. I hope. Sorry. Thank you. An important part of our mission here at Robert Wood Johnson is to build partnerships and foster collaboration and education beyond the walls of our academic health campus. Discussions like the one we'll engage in this evening are key parts of our mission to encourage the free exchange of knowledge and to enhance the quality of life and raise the health status of the diverse communities that we all serve. Human trafficking by any personal or statistical measure is an alarming problem with many victims. The 2014 U.S. Department of State Trafficking in Persons report cautions that numbers fail to convey the true impact of human trafficking on our society. The report noted that reliable statistics pertaining to human trafficking are difficult to find. Few victims and survivors come forward for fear of retaliation, shame, or lack of understanding for what is happening to them. Numbers truly do not always tell the story. The report goes on to urge the media to focus on individual stories of survival, new initiatives designed to stop trafficking, or innovative research efforts to shed light on this brutal, soulless crime. This evening, all of you are here to focus on this issue and offer unique insights and expertise to develop strategies that will attack trafficking at its source and prevent it from harming more innocent individuals. I'd like to thank the following individuals and organizations for their support and hard work in making tonight's program possible. Prevent Child Abuse of New Jersey, the New Jersey chapter of the American Academy of Pediatrics, Robert Wood Johnson's Level 1 Trauma Center and Injury Prevention Program, the members of our planning committee, and all of our panelists who have been so kind to take time from their busy schedules to share their evening with us tonight. I hope it is a meaningful discussion that will evoke a renewed commitment for ending human trafficking and restoring the dignity of victims affected by this horrible act. Once again, thank you for joining us. And now please join me in welcoming Diana back to present our panel and discussion for this evening.
I would like to invite our panel members to come up to the stage, and while they're doing that, I'm going to go over how the evening is going to run, because you probably are like, what is going on here? While our panel members come up, as you can see from our program, we are going to have 6 panel members up here who are going to talk about a variety of topics. Once that's over, you will have an opportunity for question and answer. So please hold your questions. If you jot them down, we will be coming around with the microphone into the audience, and you'll have plenty of time to ask your questions. Once we're done with that, we are going to split you into 5 groups. And you can choose which group you go into, but the groups will be based upon what our panel members are talking about. And in those groups, we are going to start working on an action plan. Because so often you come to conferences like this and you learn about topics and then you walk away and you go, okay, now I know everything about it. What am I supposed to do? We don't want you to do that. We want this to be a working audience who can join together with other people from the community and start making a difference when we're talking about decreasing and combating human trafficking. And just a little story, I was on the phone yesterday with one of my law enforcement buddies out in the community, and I was telling him that somebody from his police department ought to be coming to this event because I think it's very important for law enforcement across the board to know about this. And his response to me was, oh, but we just really have a problem with prostitution. Now, we know that that's what we're talking about tonight. So I think it's really important for all of us to be able to leave here and be able to help to educate the people that we come in contact with, to help to advocate for survivors of human trafficking, to understand how to prevent it from happening in the first place, and hopefully help a lot of you to understand how to recognize those red flags. That's really what we're here about tonight. So I would like to introduce Fran Gallagher, who is going to be our moderator for the evening. Fran serves as the Executive Director for the American Academy of Pediatrics, New Jersey chapter, the New Jersey chapter, which is home to the Pediatric Council on Research and Education, the quality improvement arm of the AAP New Jersey chapter that is dedicated to improving the quality of health in New Jersey's children. The NJAAP has outreach programs focused on child abuse and neglect prevention and suspected child abuse intervention, disaster recovery programs such as the Pediatric Partnership Initiative designed to help healthcare providers identify red flags of toxic stress and early identification of delays or disabilities. She serves on the New Jersey Department of Children and Family and New Jersey Department of Health work group tasked with creating educational outreach on human trafficking. Fran holds a BS in speech pathology and a master's in early childhood special education and is passionate about systems integration, working and communicating across systems to ensure optimal health outcomes for infants, children, adolescents, and young adults. Fran.
Good evening. So as you heard, we have 6 panelists, a very full agenda. We're going to be covering topics such as advocacy, referral and resources, enforcement, recognizing trafficking, and prevention. We have a wealth of information up here on the panel, and each person has been asked to speak for 10 minutes. And as Diane had shared, we're going to ask you to jot down your questions because there will be time at the end to ask your questions. I have been instructed to be a hook. So at 10 minutes, which is hard to do. There's so much information here that you're sharing in such a short period of time. So in any event, our first speaker is Reverend Mandy Bristol Leverett, and she's going to be addressing advocacy. She is a steering committee member of the New Jersey Coalition Against Human Trafficking. Reverend Mandy is ordained by the Assemblies of God and has worked with New Jersey at-risk kids and youth since 1998. Reverend Mandy has spread modern slavery awareness since 1993. She is the founder and director of the Church Abolition Network, known as CAN, as well as the director of the Calvary Temple International Abolition. Reverend Mandy is also faith-based subcommittee member at the New Jersey Task Force and a Justice Track member at New Jersey City Serve. So without further ado, I will turn it over to you.
Thank you for having us. I represent the New Jersey Coalition Against Human Trafficking today. Senator Chiesa, at a recent meeting at the State House, said that our greatest weapon to fight human trafficking is our citizens. And that's so true. Much of what we do at the New Jersey Coalition Against Human Trafficking is mobilizing citizens. Citizens that have different connections, different gifts, different things in their hands, so to speak. And so we like to connect those kind of resources together. I put it this way, it takes everyone's eyes to find what is hidden in plain sight. And New Jersey citizens can do more than our law enforcement, more than our laws, as great as all of those things are, because we are everywhere. And so empowering citizens to do something about abolition is vital to this abolition movement throughout New Jersey and our nation. There are faith-based groups like, for example, the Assemblies of God, who last year, they were able to lend 2 of their co-missionaries to have Say Something assemblies in the high schools throughout New Jersey. They had the tools of technology and screens, and they were able to partner with our Justice Department and our Attorney General's office to make that happen. So they were able to use what they had in their hand. And I don't know what you have in your